Hey, hi, my name's AJ and I'm a registered nurse at the Ward Institute. Today we're going to be talking about your aftercare post-surgical instructions for an upper or a lower blepharoplasty. Blepharoplasty is where they go in and remove any excess skin above or below the eye that may impact your vision fields or just your overall appearance of your face. So today we'll talk about any of the wound care or post-surgical instructions that you might have after surgery. After your surgery is finished in the OR, a registered nurse and the CRNA will roll you to your recovery room where your vital signs and airway and you'll be monitored closely for however long it takes you to kind of wake up. Once you give us 2 thumbs up and kind of tell us who you are and where you're at, you're safe to go home from our standpoint. But before we let you go, we'll bring back whoever it is that's staying with you and taking care with you, and we'll go over some post-operative instructions. So in the immediate post-op period of time, we mostly, especially that night, want you to get home and get comfortable and relax on the couch. We want you to sleep with your head slightly elevated above your heart and in a neutral midline position to help with any swelling or bruising in that area. A registered nurse will tell you exactly when you can kind of restart your diet, what foods to eat, and they'll also go over any medications that can be restarted, and then all of your surgical medications, when to start those and how to take them. Following a blepharoplasty surgery, sometimes vision or sight can be very difficult because the tissue of your eyes and around your eyes is very thin and it's very prone to swelling. So it is not uncommon to have your eyes kind of swell shut to the point where you might not be able to see for a few days. Don't panic, that can be a totally normal occurrence after surgery. And once the swelling comes down, your vision you'll be able to open your eyes and kind of see better. Swallowing following a blepharoplasty surgery can last typically up to 4 to 6 weeks. However, you will see massive improvement after the first week to 10 days after surgery. Typically, a peak swelling is around days 3 through 5, and then around a week, you'll start to notice very subtle improvements throughout that time. The incisions and the scars around the eyes heal very well in a blepharoplasty surgery. Most scars are not noticeable within the first 2 to 3 months. And once that swelling goes down, any blurriness or any restriction to your vision that you had prior to should be vastly improved. We also highly recommend that you purchase in office what we call our blepharoplasty goggles. These are pretty cool high-tech goggle that we send home with clients after a blepharoplasty that look like typical skiing or snowboarding goggles. The foam inside the goggle lens actually has a natural cooling mechanism to it and allows compression in that area. We highly recommend these goggles as they can improve your downtime, they improve swelling and the overall healing in that area. We highly recommend that you wear them kind of continuously within the first few days of surgery. And then after about 6 days, you can start to wear them as tolerated, but specifically wearing them at night can help improve a lot of that swelling that you might find in that area. When you come in for your 1-week post-op visits, which can be anywhere from 6 to 10 days after surgery, a nurse or an MA will remove the sutures in your upper or lower kind of eyelid area. Once those sutures are removed, you'll still want to clean and apply any ointment to that area. If you ever have any questions or concerns, we highly recommend that you call our on-call after-hours service at any time.